Hello everyone. For this week's blog, we took the Leadership Skills Questionnaire. I scored 22 for the administrative skills, 28 for interpersonal skills, and 21 for conceptual skills. I honestly have a difficult time interpreting these results as I've not yet really moved into a managerial leadership position at work. Therefore, I feel like my responses were based on how I would ideally like to approach the position. So who knows if I would be as effective, because I scored high, who knows if I would be as effective as the questionnaire might suggest. I have been paying very close attention to how our management has dealt with our unit crises, and such as census growing and staff turnover. So it gives me an idea of what I might do differently. If I were to move a level up from where I am right now, I would be a charge nurse / clinical supervisor. As far as our hospital is organized, I would say it's more of a horizontal concept, including a matrix structure. Clinical supervisors report to our manager for labor and delivery, and then there are several managers for the various components of the women's division. Our hospital system in general is enormous, so there are larger divisions spread out among the upper level management. So as a clinical supervisor, they work really closely with the other units in the women's division, antepartum and postpartum, and they have to be aware of the status of these sister units when managing bed assignments and anticipating staffing needs. We need to know if there are any high-risk patients teetering on the edge of coming to labor and delivery. We need to know if we have postpartum beds or if they're anticipating discharges. If one of the units is busy, chances are that will affect all of us. Clinical supervisors also work closely with the doctors, especially maternal fetal medicine attendings who are accepting high-risk transfers from outlying hospitals. They need to know if we have the nurses, the bed space, NICU beds, and so it's really important that we communicate with them. In addition to all the medical staff, we also work really closely with dietary and environmental staff. Diet orders on labor and delivery constantly change based on a patient's labor status, and sometimes patients only have a small window of time that they can enjoy a meal before an induction has to be started, or sometimes a patient has been laboring for 2 days on a clear liquid diet, so you want to get them a regular tray as soon as they deliver. So dietary is essential to our work. And then, of course, environmental services. We couldn't do it without them. We have such a high patient census, and we have to keep things moving. We have to get our patients out to postpartum and get the labor rooms clean. So I guess you could say it all comes down to planning as the primary function of the manager, the clinical supervisor. It's how you anticipate the needs. Staffing and support from other units are the only ways to keep things rolling. Labor and delivery is unpredictable, so you have to plan as best you can, but also be aware of all the factors that can make things change quickly. Putting myself into this role, I understand that I would have to use all of the essential functions that are mentioned in our book, Leadership and Management in Nursing. Planning, organizing, coordinating, directing. I'm thinking specifically of the biggest challenge facing our unit at the moment. We're preparing to see more patients deliver in the next few months than we ever have before. Our management, starting with the support and input of the clinical supervisors, is helping us to come up with a plan for overflow and bed management. So this is when I started to really think about the concept of transdisciplinary care, and research that goes into making process changes. So in our case, environmental services, dietary, lab, and nursing all have to be on board and part of the plan from the get-go. It's not, I read somewhere that transdisciplinary is when people come together from the beginning to communicate and exchange ideas, and they start working together to solve a problem before. So it's different. I guess what I'm trying to say, it's different from multidisciplinary care, where people kind of think about themselves and their own solutions, and then they come together. So we really have had to sit down and work with everybody in all the different departments, like I said, environmental services, dietary, whatever, to have everybody on board with the plan from the get-go and making sure everyone has input. The article I chose to read for this assignment was called Resistance to Change in the Nursing Profession, Creative Transdisciplinary Solutions, by Carrie Clark. And I liked what she said when she said, does change have to be chaotic and painful? Are there measures that we can enact to ease this process? How can we use reflective processes to expect change and create what Watson states that Florence Nightingale envisioned nursing to be: caring, kindness, love, and heart-centered, compassionate service to humankind? And she goes on to say, if we move toward viewing conflict as an opportunity for reflection and as a call toward dialogue to realize transformation, we can honor its place within the group change process. So I guess what I'm trying to say is, as a clinical supervisor, if I'm putting myself in that role, like I did for the skills questionnaire, I would strive to use all of the skills that I have read about, as well as evaluate myself with some sort of questionnaire like that. I at this point enjoy the idea of a horizontal model, with specialty matrices in the structure. Women's division requires a manager to not only be well versed in interpersonal skills, but also relies on the ability to focus on administrative tasks and really understand how your decisions affect the healthcare system as a whole. And I think that's the concept that right now is still so abstract to me, is understanding what my limitations are as a manager, as a clinical supervisor, because as a staff nurse, I can tell you all the ways that you can help our job, but thinking as a manager with the budget and the policies and those kind of restraints added on, having to follow the organization's process, it does change things. And so this exercise of trying to put myself in their position has helped me to realize how complex it really is, and how much we rely on that transdisciplinary communication to get us through these process changes, and how important it is to have, in my opinion, a horizontal structure, because I think in that version of hospital organization, there's a lot more ability to everybody has more of a voice because everybody has more input. There's not a hierarchy where you have to go straight up to the top to get what you need accomplished. So, yeah. I hope everybody's having a good week.